Hey everyone, welcome back to the channel. My name is Aryan Malik. I am a nursing student. This is Study with Me series, and today is day 21. We are continuing our discussion on fundamentals of nursing, and today we'll be talking about death, dying, grief, and loss. Let's start with grief and loss. There are different types of loss, and the five stages of grief are basically grief, unhealthy grieving, and euthanasia. These are some things that we'll be discussing. Let's talk about the sources of loss. So, there is an aspect of self, um, for example, loss of organs, loss of independence, loss of limb, and then there is external objects, for example, loss of money, house, or pets, and then there is loss of familiar environment, for example, leaving home or losing a home and moving to a new place, and losing loved ones, divorce, or death. And now let's look at how loss is defined. It is actual or potential situation. So, what do I mean by that is something value, like a value is changed or it's no longer available. So, what is actual loss? It can be recognized by others. For example, a person who has gone through a loved one's death or divorce. Perceived loss is experienced by a person but cannot be verified by others. For example, loss of freedom when becoming a stay at home mom. This is something that other people might not be able to notice, but the person herself is experiencing that. Next is anticipatory loss. It is experienced before the loss has actually occurred. So, say a family member that is actively dying but has not yet passed, so it will be characterized as anticipatory loss. Now let's look at Kubler-Ross five stages of grief. First is denial. The client is not accepting the reality of the situation and is in disbelief. Second is anger. They may be it may be displayed to loved ones, nurses, or the doctor. Also, there is the feeling of guilt and resentment. Next is bargaining. The client negotiates for more time, stating, if only I did something, or if only I was a better mother, better parent, better guardian. Next is depression. The client struggles to accept reality. Next is acceptance. Client has come full circle and accepts the reality. Let's look at an example. The client appears angry and demanding following a below the knee amputation. What will we characterize this as? So let's look at the keywords in the example angry and demanding. So we can say that the client is having difficulty accepting the new body image. Let's look at another example. After being told the feet will need to be amputated, the client states, I am sure if I start taking my medication, my feet will heal. Example of which behavior? The client is in denial. Another example is acute grief process. So, which of the following statements made by the client indicates understanding of feelings? Select all that apply. I might experience feelings of resentment. Yes. I might have some guilt over how my partner died. Yes. I might have angry feelings that I should express. Yes. So, all are correct. Now, let's look at Bowlby's four stages of grief. They are numbness or protest, disequilibrium, disorganized and despair, and reorganization. These are not very often tested. It is just important to know their names. So, if they by any chance show up, you will remember them. Now, let's look at coping and defense mechanism, which is one of the most tested on the NCLEX. So first is displacement. It is basically shifting of anger or impulses from an outside situation toward another person. So let's look at as an example. So what best describes an instance when displacement is used as a defense mechanism? So a man who loses his job goes home and yells at his wife. So they are basically displaying anger towards another person. It's anger displaced. Second is repression. The person here hide or ignore painful memories instead of facing them in hopes of forgetting them. So say a 20-year-old was sexually molested at age 10 but can no longer remember the incidents. So the defense mechanism used here is repression. The third is compensation. The client is overachieving in one area to compensate for failure in one area. Say individuals with poor relationship with family might direct their energy to excel at work. So they are compensating their loss at one end to become better at another. The fourth is undoing. So the client basically cancels out unhealthy bad memories by doing something good. So say the client's adult child provides all care for the client and refuses help. I created a lot of problems for my parents when I was younger. Which defense mechanism? Undoing, because the client is trying to undo things they did before. Next is sublimation. It basically the client channels acceptable desires into activity that is appropriate and safe. For example, an adolescent client with a history of violence, what would be the defense mechanism for them? So they joined a competitive boxing team. It will be an example of sublimation, because through that sport they're getting all their aggression out with actually a good sport. So let's look at a few more examples for sublimation. So say the client is told she cannot have children and the client forms a close attachment to the niece and nephew. It's an example of sublimation. A client who was bullied about his interest in chemistry now tutors students having difficulty with science. Again, an example of sublimation. The next coping mechanism is projection. It involves taking unacceptable qualities or feelings and pinning them on other people. So basically, projecting what you do not like about yourself on other people. Let's look at examples. So, say a nurse provides care for clients on the detoxification unit. One client says to the nurse, I know you despise me. Projection is the defense mechanism used by the client. Now, say a graduate nurse fails an examination and accuses the psychiatric instructor of being an unfit teacher and causing the failure. It's again an example of projection. You are projecting. The next coping mechanism is rationalization. It's basically justifying illegal or irrational ideas or feelings. For instance, client with anxiety avoids social interactions while justifying these behaviors with various excuses. Which of the following defense mechanisms? Rationalization. They're justifying it, they're making rationals for themselves. Another example is a client with alcoholism states, I need a drink or two to relax after a busy day at work. I have an incredibly high stress job. Defense mechanism again is rationalization. The client is just trying to justify their irrational or bad habits. The next coping mechanism is identification. A person adopts a behavior of a person who is perceived to be more powerful. So, say a client on the psychiatric unit seeks out a particular nurse and imitates her mannerisms. We see here identification, defense mechanism being implied by the client. Now, let's look at some examples or some forms of unhealthy grief. First is unresolved grief. It's basically extended in length and severity. The stages of grief here may be the same, but the person grieves for an extended period of time. Next is inhibited grief. Normal stages of grieving are suppressed. Next is exaggerated grief. Here, a person is using dangerous activities to lessen the path of grieving. So, the strategies to cope here are maladaptive. The last is complicated grief. So, here the grieving lasts more than 6 months and leads to an inability to perform daily activities. Now, I want to dive deep into complicated grieving, and let's analyze what are some signs of complicated grieving. So, the client fails to grieve, they refuse to participate in their normal daily life activities, they recurrently they are recurrently symptomatic of grief on the anniversary of the loss of loved ones or holidays. They have persistent guilt and continued search for the lost person or the person who passed away. Small events can trigger grief symptoms similar to PTSD. They are unable to discuss the loss without crying or becoming tearful. Lastly, relationship with friends and family often deteriorates. Now, let's look at what are some nursing interventions or actions that we can take on our part to help the client with the grieving process. Particularly, I'll be focusing for the first section on pediatric. So, we implement something called play therapy, as we all might know that the kids are not able to express what they are feeling in words. So, having some kind of play activities like building blocks or having them paint helps ease out the process. And another is if they ask us any questions, we answer them honestly and we provide them with therapeutic touch. So, say the parent of a younger child asks the nurse why the child is involved in play therapy, which statement is best? Young children have difficulty verbalizing emotions, so that is why we encourage them to be involved in play activities like painting or building blocks. A 6 year old learns about the death of a grandparent. What will the nurse include in the parent's teaching plan? Select all that apply. I'm sorry about that. Sorry. Here we go. So, promote activities that the child enjoys, like play therapy. Encourage the child to express feeling through coloring. Answer the child's question honestly, and hold and cuddle the child to reinforce closeness, or in other words, therapeutic touch. Now, what will be our nursing interventions for adults going in the grieving process? We encourage therapeutic communication. We sit with the client and we encourage them to take part in support groups so that they can be amongst other folks or clients who are going through the same process. And we also encourage them to focus on good memories. Now, say a nurse is caring for a client who just delivered a stillborn fetus at 36 weeks of gestation. Which of the following statements should the nurse make? As a registered nurse, one would say you may hold your baby as long as you want. Here, the key word is hold your baby as long as you want. Now, say an older client whose spouse died 6 months ago. Which behavior by the client indicates effective coping? Select all the apply. Looking at old snapshots of the family? Yes. Participating in a senior citizens program? Yes. Visiting the spouse's grave once a month? Yes. Decorating a wall with the spouse pictures and awards? Yes. Now, uh, let's particularly look at palliative care and hospice. Say, let's talk about terminal cancer. Here we know that the clients will pass away from this untreatable cancer, and they typically go home after a while on hospice care for their own comfort. Palliative care is delivered by team, and the goal of the care must be set up to ensure decision making. As part of the healthcare team, it will be our responsibility that the client and family should be educated on types of treatment and end of life care. The family should always participate in decision making, but the ultimate decision lies with the patient or the client. Healthcare team also delivers intense psychosocial support to help with the care. There is also a component of therapeutic communication, which should be factual, meaning having facts about the treatment, be open and honest to convey empathy. The nurse should reduce the family's fear and anxiety by educating the family. It's very important. Make sure you make a note of it. Let's look at example. The client who has terminal cancer tells the nurse, "I wish I could stop these treatments. I am ready to die." Which of the following statements should the nurse make? Discontinuing the treatment is your choice if you choose to do so. Again, it's the client's ultimate choice. We do not comment or say anything to the client. Their choice is the ultimate choice. Now, let's look at grief and loss, particularly euthanasia, which is practice of intentionally ending life by healthcare providers to eliminate pain and suffering. Firstly, let's look at active euthanasia. They are actions that bring about the client's death directly with or without the client's consent. Example: administering lethal dose of a medication. This is illegal across the United States. Next is assisted suicide. It's giving the client the means to kill themselves if they request. It is mostly illegal across the country except in 10 states. Lastly, we have passive euthanasia. It's withholding life sustaining therapy and withdrawal of extraordinary means of life support. For example, removing a feeding tube or ventilator and allowing the client to die without intervention, for example, DNR or do not resuscitate, and no code status. This is client's wishes, and their wish is the ultimate choice that we as healthcare providers will honor. I hope you found this video helpful. Please stay tuned for more videos that will be coming out in the future. Thanks for watching.